Hello, and welcome to another episode of Code Rhetoric with Tam Talk. I am your coding coach, Tam Talk, and today we are talking about, hold on, wait a minute. Poison, pick your poison. My poison is a little cold, so we need to warm that up. But yes, today we are talking about picking your poison. So today I will be giving a quick review of the adverse effect, poisoning, underdosing, and toxic effects table as it relates to drug coding or coding for drugs as a diagnosis code. So I will leave the reference of the specific guideline in the description box. But this video is just an overview, a highlight of the table of drugs. And so what we will be discussing on today's video is the different aspects of drug coding, again, such as adverse effects, underdosing, poisoning, as well as toxic effects. So let's get into it. So let me take another sip of my poison. Okay, let me put that down. So I will be referencing the table of drugs, right? So yeah, let's get into it. So first, let's define what these conditions are, right? That's the first thing. Let's define what they are, because we may have a different interpretation or meaning of what those particular terms mean. So our first one is adverse effect. What exactly does adverse effect means? Adverse effect is when a drug has been correctly administered and properly used or correctly prescribed, and the patient takes it appropriately as it was prescribed or supposed to be administered, and they develop a reaction to it, such as a rash or, in worst case scenarios, their throat start to close up. So that is an adverse effect. So the patient administered the drug per the prescribed instructions, and they still develop an adverse reaction. Number two, poisoning. That's just, improper use of drugs. It wasn't prescribed. It wasn't prescribed. You just took a drug. And typically this kind of falls into like where someone's trying to commit suicide. So they take a drug, in hopes to, fulfill that particular goal. And that is called poisoning. This is where poisoning comes in, because it wasn't prescribed by a provider and the patient did not follow the instructions per the manufacturer's guidelines as it relates to taking that particular drug. Okay, so that is poisoning. Underdosing. Underdosing is when we're taking less than the dosage amount that was prescribed by our provider or, again, by the manufacturer's instructions. So let's say, for example, an elderly patient, right? They're having to choose between food or having to pay like the light bill and taking in their drugs, and so, or paying for a refill of medication. So they decided, okay, well, I'm going to take some of the drug. I'm going to take half of what is actually required or prescribed by my provider. So that is underdosing. They're taking less than what was actually prescribed for them. And then the next one is toxic effects. So toxic effects is when a harmful substance is ingested or comes in contact with a person. Okay? So it almost sounds like an adverse effect. It's not adverse effect is when it's actually taken appropriately as prescribed and the patient develop a reaction to it or response to it. Toxic effect is when a harmful substance, so there's the key, a harmful substance is ingested or comes in contact with a person. And that actually can fall under poisoning as well, because poisoning is the improper use or the improper administration of a drug, whereas toxic effects has to do with a harmful substance, right? Harmful, perhaps this particular drug or this substance was not intended to be ingested or come in contact with the patient, right? Perhaps it could be a skin issue, like we're not supposed to touch it, right? But when we touch it without gloves, then it creates a toxic effect. So yeah, so those are the conditions. Again, it is adverse effect, poisoning, underdosing and toxic effects. And as I mentioned, I will leave the specific reference to this table and guideline in the description box. So let's go a little bit more into what adverse effect is as it relates to coding. So the nature of the adverse effects, such as tachycardia, delirium, or etc. And number two, adverse effects. The code range is T36 through T50 with fifth or sixth character S, right? Poison is code ranges T36 through T50. So to be honest with you, all of these, the drug code range or the drug table range is T36 through T50. Did I say that? Let me clarify that. To find the adverse effects, poison and underdosing toxic effects, ICD-10 codes for those particular diagnoses is listed in code range T36 through T50. There, we got it correct. So when we are coding an encounter where one of these items is the diagnosis or was the final diagnosis or assessments by the rendering provider, again, we do reference the table of drugs because we want to make sure we're coding it to the highest specificity. Again, when we're coding to the highest specificity or when we're referencing the table of drugs, yes, it is important because we are getting the codes that are specific to that drug. However, we should not stop there when it comes to getting our drugs, our codes for our drugs. We are then to go to the tabular list to reconfirm or to confirm those codes that we have selected. And here's the importance of why we should go to the tabular list is because it, again, in the tabular list, there may be further instructions as it relates to how to code or assign a diagnosis code. And then two, we want to make sure it is coded to the highest specificity. Again, the table of drugs and even the index gives us maybe the prefix of a particular ICD-10 or diagnosis code, but the tabular list code give us the entirety of the code, making sure it is coded to the highest specificity. So we may get like a 4-digit in the index, but when we go to the tabular list, it may be a 7-digit code. So that's why it is important that we refer to the tabular list to reconfirm our codes, right? So think of it like a dictionary per se. Like if you're looking up a definition, of course you're going to look up the word, right? And then you're going to refer back to, I would say, in that case, the tabular list to confirm the definition of that particular word. So the same thing is with coding. You may have a generic term, or let's say fever, right? And fever gives you a code, but then the doctor may give you a specific type of fever. So you can reconfirm that diagnosis and making sure it's coded to the highest specificity by referencing the tabular list. But we won't get too much into the tabular list. That could be another video. But yes, so back to, again, our drugs, or poison, excuse me. So again, there's an adverse effect, poisoning, underdosing, and toxic effect. So again, I will leave that guideline in the comment section, description box, so that you can reference it for yourself and get a further explanation or a little bit more insight into coding for adverse effect, poisoning, underdosing, and toxic effects. So I am going to go and warm up my poison because my poison is cold. And wait for the next video. Take care.